Good evening. I'm Warren Tyson, and tonight we'll be discussing why we should wear face masks in public. As we all know that we're in a difficult time right now with COVID-19 running some very large numbers. The transmission of the virus was slowed at one point from March until May, but it appears to be from around Memorial Day weekend. It's when a lot of Americans went on vacation, mainly to the beaches in Florida, Texas, New Mexico. States having a beach area. The numbers seem to be on a sharp rise of infections. Shortly thereafter, a lot of states that had reopened shopping areas, bars, and public outings closed them again because of the high number of new infestations. Wearing a mask in public has had some mixed reviews. A lot of people seem to think that here in America it's not our constitutional right to have to wear a mask that someone says that we do, and we shouldn't have to be told what we can and can't do. But it's not just an individual choice of wearing a mask, because if you're in the event that you're carrying the virus and you're in public and you're not preventing yourself from exposing others, you could be at a risk. That is similar to sexual type infestations or diseases that require a person to tell their mate that they are infected with some type of disease before they're intimate. If not, they could be held for that crime and be punished by the law. Recently, the CDC has recommended that we wear face masks in public and around anyone other than ourselves to prevent the spread of the disease. It comes from a cough, it can come from a sneeze, it can come from just breathing if you have the air. Yes, it can be contaminated. Lots of things can be contaminated. If you touch your mouth, if you touch your face, you touch a box. There's less likely of a chance that you're going to touch your mouth if you have a face mask on. Recently, the governor of Alabama, Kay Ivey, on July 15th made it mandatory for the entire state of Alabama, if you go out in public, to wear a face mask. If you do not, there is a $500 fine on the first offense. Dr. Roth Schunk wrote an article in the New England Journal of Medicine that was distributed by the CDC that said the experts, in their opinion, the evidence is clear that the wearing of a face mask has seemed to lower the spreading rate in areas where they've monitored the numbers. Initially, we thought it was a low-key defense, that disease that wasn't that easily transferable, but we have found out now that it's easily transferable, and that the washing of our hands and the wearing of a mask is definitely slowing the numbers down. if you will look at food preparation, doctor's offices, retail shops that are wearing the mask, you can see that the general public in certain areas are trying to reduce the spread of the disease. There is no shot, there is no pill at this particular time that will basically exonerate you from getting the disease or getting rid of it. The death toll now is increasing. The deaths do seem to be on older individuals and individuals with pre-existing health issues. I play the guitar a little bit, and I lately saw that Joe Diffie, country singer that wrote Pickup Man, a song that I was trying to learn, had passed away, and they had labeled it as COVID-19. Also, University of California, San Francisco, done some studies on should we wear a mask, and still confused about wearing a mask. And their ending argument was that the strongest evidence is the growth rate. The growth rate slowed in the first 5 days by 0.09% by wearing a mask. And then subsequently thereafter, down to 2%, or 2%. It slowed the entire growth rate in a controlled area where they were studying the people that were wearing masks versus people not wearing a mask, that the growth rate had slowed an incredible 2%. So that is some numbers to look at of why wearing a mask. They are uncomfortable. If you wear glasses, as I have on right now, and they can fog your lenses. We all have some reasons why we don't want to. Females have said that it breaks their face out, it takes their makeup off. I myself have some on the sides of my face. I think that could be caused from it. I'm not really sure. I work out of doors on the weekends, but I do believe that it is right in that area. I have several areas that I think that concur with the females that it breaks my face out. Wearing a mask, regardless if you want to or not right now, is mandatory by state law. And if you have a $500 that you would just like to throw away every time you step outside and an officer of the law will see you, they will give you a citation. Also, every business that I have went into since Governor Kay Ivey has issued the order on mandatory face masks, they have signs and will not wait on you or service you in a business without a mask. So, with the studies that I've mentioned by Dr. Bai and Dr. Roth and the CDC and the documentation that is up at alabamapublichealth.gov that is given to us by Governor Kay Ivey, appears to be in the positive side that wearing a face mask will reduce the transmission of COVID-19 virus. So at this point, with the studies and with the law, we have no other choice but to wear a mask right now. And if you're coming in contact with me and my family and you're not a family member, I don't know you, I would prefer that you have a mask on. One, is the law. Number two, I don't want to be infected with the COVID-19 virus. I'm Warren Tyson. Today is July 25th, and this was my presentation on why we should wear a mask in public. Thank you, and have a good day.